Chapter 14, Part 7, Evaluating the Effectiveness of Psychotherapy. Decades of research demonstrate that psychotherapy is effective in helping people with psychological disorders. Some people eventually improve simply with the passage of time, a phenomenon called spontaneous remission. Researchers use a statistical technique called meta-analysis to combine and interpret the results of large numbers of studies. Comparing people who receive psychotherapy treatment to no treatment controls, researchers consistently find that psychotherapy is significantly more effective than no treatment. On average, the person who completes treatment is better off than about 80% of those in the untreated control group. Benefits are usually apparent in a relatively short period of time. Gains that people make tend to endure. Brain imaging technologies show that psychotherapy alone produces distinct physiological changes in the brain that are associated with a reduction of symptoms. Is one form of psychotherapy superior? A surprising but consistent finding emerges. In general, there is little or no difference in the effectiveness of different psychotherapies. The fact that there is little difference in outcome among empirically supported therapies does not mean that all forms of psychotherapy are equally effective. Eye movement desensitization reprocessing, EMDR, developed by Francine Shapiro, is a technique of therapy in which the client holds a vivid mental image of a troubling event or situation while rapidly moving his or her eyes back and forth in response to the therapist's waving finger, or while the therapist administers some other form of bilateral stimulation, such as sounding tones and alternate ear. Originally touted as a one-session treatment for PTSD, EMDR today often involves multiple sessions and is used to treat numerous disorders. Researchers have found that patients benefit from EMDR and that EMDR is more effective than no treatment at all. EMDR is no more effective than exposure therapy, a behavioral technique in which the person is repeatedly exposed to the disturbing object or situation under controlled conditions, and other standard treatments for anxiety disorders, including PTSD. Several research studies have found no difference in outcome between treatments that incorporated eye movements and sham EMDR. EMDR displays several of the fundamental characteristics of a pseudoscience. EMDR highlights an ongoing problem in contemporary psychotherapy. Revolutionary new therapies are developed, advertised, and marketed before controlled scientific studies of their effectiveness have been conducted. What factors contribute to effective psychotherapy? Researchers have identified a number of common factors related to a positive therapy outcome. Quality of the therapeutic relationship is the most important factor. Therapist characteristics include a caring attitude, the ability to listen empathetically, and sensitivity to cultural differences, among others. Client characteristics include motivated, committed to therapy, and actively involved in the process. External circumstances can have an impact. A stable living situation and supportive family members help. Increasingly, mental health professionals are moving towards eclecticism, the pragmatic and integrated use of techniques from different psychotherapies. Eclectic psychotherapists carefully tailor the therapy approach to the behaviors and characteristics of the person seeking help. Cultural values in psychotherapy. The goals and techniques of established psychotherapy approaches reflect European and North American cultural values and may clash with the values of clients from other cultures. Recognizing the need for psychotherapists to become more culturally sensitive, the American Psychological Association has recommended formal training in multicultural awareness for all psychologists. This concludes this part of Chapter 14.